morning, Mrs. Lyons. It's quite early in the morning, but I see you're awake. It's about 6 o'clock. How did you sleep last night? That's good. I'm just going to have a look at your chart. I think you have some medications due this morning. So come over here and have a look. Have you got any pain? You can see here you're on some regular paracetamol. Is that helping with your hip pain? Okay, that's good. Well, we'll give you a dose of that this morning, and you're then due some other medications, some subcut injection and some IV antibiotics that will go in your drip later today. So we'll be back to do those at 8 o'clock in the morning. I'm just going to check your armband now, but could you just tell me what your date of birth is? Okay, so the 23rd of the 7th, 1921. I'll just double check that on your armband. '23rd of the 7th, 1921. Okay, and you are Ivy Lyons, and your MRN, your record number for the hospital, is 555 67890. That's 555 67890. So now I'm sure I've got my right patient. I'm just going to go back to the end of the bed and get your medication for you. Okay, I'm just going to check that I have a valid and legal medication order before I proceed. So I'm looking that the order is legible. I have a doctor's signature on the order here, and I'm able to page that doctor if I had any queries about the medication order. So it was ordered yesterday because today's the 17th of February. And I can see up here that on the 17th, which is today, at 6 o'clock in the morning, the medication has not been given. So I can proceed now, looking at my medication. So right drug is paracetamol. Okay, so I'm checking that that's legible, and it's paracetamol. My route is oral, so per oral is PO, so I'm going to give this dose orally. My right dose is 1 gram. And the frequency or the right time is QID. Now when I check this, I also check that it has been ordered 4 times a day, which is QID, and it has at 6, 12, 6 o'clock at night, and then 10 o'clock at night. So I'm going to proceed to give this medication at 6 o'clock in the morning. I've just looked up paracetamol because it was a drug I was unfamiliar with for the reason that my patient was taking it. I know that Mrs. Lyons has had a hip replacement, and so she's on this non-narcotic analgesic for her bone pain, and it's quite effective for that. I've learnt through this, and it's important that she continues to take this drug even if she starts to feel pain-free, because it will give her a long-lasting analgesic effect. And I've just looked up the contraindications and any adverse reactions that I should be on the lookout for this medication. So I would normally do that for any drug that I was unsure of the indication for, or why my patient in this particular instance was on it. Okay, now I've checked that I've got the right patient, so the patient matches the medication chart, and now I'm going to check the 5 rights on the medication chart with my medication. Right, I'm going to dispense the medication. I'm going to clean my hands. Do some hand wash. 30 seconds. And wait for those to dry. Okay, I'm going to get out a medication cup and find my medication, which is paracetamol. So this is my first check. I've picked up paracetamol, and I can see it's paracetamol. Now, whenever checking medication, you always check inside the package and not the box, so you always check the blister pack. So I'm going to spin it over, and I do indeed have paracetamol. And the dose here is 500 milligram tablet. Another thing you always check with your medication is the expiry date, which is September 2010. So I'm right to go ahead and give this. So I'm going to go back and check my 5 rights again. I have my right drug, which is paracetamol. Paracetamol It is an oral tablet. I'm giving it oral, and I need a gram dose. So actually here I have 500 milligrams. So quick drug calculation, I know I need to give 2 tablets. So I'm going to go ahead and dispense these into the bottle. And for my final check, I'm just going to triple check actually that I do in fact have the right drug and I have given the right dose. So it's paracetamol, 500 milligrams, 2 tablets equals a gram. So that's my last check. I'm going to return this to the medication trolley. Hi Mrs. Lyons, I've dispensed your paracetamol now. I just finally check you are Ivy Lyons. I double check your name band if I'd left the room, but I've already checked your name band against your chart and I haven't left you or left the medication since then. So I've got your paracetamol here and I'm just going to run through my 5 rights once more. My right drug is paracetamol, which I correctly dispensed. It's an oral tablet, which is my right route. My right dose is you're having a gram of this today, and you're going to have this 4 times a day. And this is your first dose at 6 o'clock in the morning. Okay, so I'll just pop your chart down. Now, how are you with swallowing? Do you have a cough and splutter a little bit with water? It's just important for me to know that you're able to swallow these tablets properly. I'll just get you a bit of water here. And you do need to take these tablets while I'm standing here because I actually have to sign on my chart that you actually have swallowed these tablets. So I do notice you don't have an allergy armband on here, and it also said no allergies on your medication chart. Do you know of any allergies you have to any medication? Okay, no, that's great. So now I'll give you the medication, checking that it's safe and you're able to swallow. Okay, Mrs. Lyons, you've just taken your tablets and I watched you swallow those, so now I can sign my name against the chart. So 17th of the 2nd at 6 o'clock in the morning, I'm going to write my initials there indicating that you've taken that medication. Okay, I'll be back at 8 o'clock in the morning for you to give you your heparin injection. If there's nothing else right now, I might move on. And you've got your buzzer there, and just call me if you need anything. Okay, I'm just going to get my hands are clean before I move on to the next patient.